So on this 34th day of the federal government shutdown, what's happening in D.C.? Well, we know the U.S. Senate did reconvene this afternoon, but no vote to try to fund the government is scheduled until at least tomorrow. You've heard the president and Republicans blame Democrats for the shutdown. Democrats say they won't agree to any funding measure until there's an agreement to extend Affordable Care Act subsidies. And that's important. This has new rates just released over the weekend for people who buy their health insurance through the ACA marketplace.
Even without those subsidies taken into account, many Tennesseans could see their monthly premiums go up by as much as 42%.
Our Rob Coles heard from healthcare advocates about the impact of these rising costs.
Really worried about families and how they'll navigate this, but not just families. I'm worried about our healthcare infrastructure.
At the Tennessee Justice Center, Michelle Johnson has spent decades helping folks get the things they need in life to survive, including health insurance. The Affordable Care Act marketplace just released their new rates for 2026. With higher costs for many in the new year, Johnson is worried folks may end up uninsured.
Families that we're talking to, they are just, it's completely unaffordable. Just don't have the money in their budget.
Regardless of enhanced subsidies, according to Healthcare.gov, most plans in our area will see an increase in cost anywhere from 10 to 42%. I took a look at a couple of plans to compare rates on the marketplace between 2025 and 2026. There's tons of variables, but a plan I found for 2025 for a 35-year-old man with no kids making $65,000 a year is $376 a month with a subsidy. A similar plan for 2026 for the same person is $544. And Johnson says that spike could change the makeup of the people in the insurance pool.
The healthy people will leave the marketplace. They will leave because they can't afford to pay that. The sick people will have to find a way to stay on.
According to the Tennessee Department of Commerce and Insurance, the rates insurance companies can charge on the marketplace have to meet certain requirements to prove they're not excessive, and the published rates meet that criteria. But many, including Emily Jenkins with the Justice Center, believe all those healthy folks leaving could drive up the cost of care for everyone in the marketplace.
It's just step one of an ongoing increase in expenses for people who remain in the ACA marketplace and need access to those plans.
But healthy or not, both Johnson and Jenkins are worried for anyone who may end up uninsured in the new year.
It really doesn't take that large of an accident or a medical event to be financially crippling.
In Nashville, Rob Coles, News Channel 5.
And with so much flux with this shutdown, advocates are recommending carefully reviewing the plans that are available to you. Open enrollment runs through December 15th for that coverage starting on January 1st. And News Channel 5's Rob Coles wants to hear from you, especially if you're worried about your health care cost. Just scan the QR code with questions or to share your own story. You'll be able to send an email to Rob.